Hi there. Many people always ask me, how do I get rid of my chronic pain? But before we go into how to get rid of it, let's find out the mechanism behind chronic pain. Now, it's obvious when we have trauma, such as when we twist our ankle, that we get pain because there's tissue swelling. The tissue swelling is because of tissue destruction, and therefore there's natural debridement by our immune system to get rid of the broken tissue. That is called healing. Now there's an unobvious way we get chronic pain, and that's called inflammation. In this Time magazine article, it talked about the secret killer, the surprising link between inflammation and things like cancer, heart attacks, and even Alzheimer's disease. But what is inflammation? Inflammation is actually a good thing, because when we get an infection such as strep throat, we want the white blood cells to go in and attack this type of infection. So they produce chemicals to fight off the foreign invader, which are also known as cytokines. However, the problem is these cytokines cause tissue swelling and therefore pain. The body also produces chemicals that cause dilation of the blood vessels in the form of prostaglandins. And these prostaglandins also cause dilation of the blood vessels as well as muscular cramping, also causing pain. Many of our pharmaceutical drugs, such as non-steroidal anti-inflammatory agents, target these two chemicals in the body and therefore relieve us of pain. Now, the hallmark of inflammation is pain, swelling, redness, and heat. But when we have chronic pain, that's when it's not so obvious. It may be something like a food allergen, a toxin in our food, an organism residing somewhere in the body that we can't even see, or toxins stored in our fat cells, such as our visceral adipose tissue, that is, the fat surrounding the internal organs that also produce cytokines in the same way as our white cells produce it against a foreign invader. These all lead to inflammation. For example, pain, swelling, redness, and heat. Yet there is another important yet never talked about cause of chronic pain, and that's called mitochondrial dysfunction. Let's look at an example. When someone is having a heart attack, the blood flow to the heart is compromised by either a clot or a narrowed blood vessel, also known as atherosclerosis. Now, since the heart continues to beat, it continues to demand blood flow of oxygen. The decreased oxygen to the cells of the heart causes them to go from aerobic respiration, that's with oxygen, through a pathway of anaerobic respiration, that's without oxygen, in order to survive. This mechanism occurs in the mitochondria within the cells. These are the powerhouses. They switch from making a healthy energy in the form of ATP to an unhealthy lactic acid which causes pain. Biochemically, the pathway that is being disrupted is called the Krebs cycle. In Krebs cycle disruption, an anaerobic without oxygen respiration occurs, where there is a lack of oxygenated blood flow to an organ, such as the heart. Anaerobic respiration creates lactic acid as an alternative source of energy, and lactic acid causes pain, and that is why the typical heart attack victim will have chest pain. Another example of disruption of the Krebs cycle can occur when you give a person a drug such as a statin, those drugs that lower cholesterol. These medications act to block an enzyme in the liver that produces cholesterol. One of the serious side effects of these drugs is muscle pain. The commercial actually tells you to stop taking it if this happens. The reason for the muscle pain is that statins also block the production of coenzyme Q10, which is an important molecule needed for the mitochondria to produce energy via the Krebs cycle. So when the Krebs cycle is again interrupted, the mitochondria must shunt from aerobic respiration, that's with oxygen, to anaerobic respiration, without oxygen, to create energy, and will then produce lactic acid, and hence the pain. Another important yet less talked about side effect of statins, therefore, is a lack of energy, again due to the decreased production of ATP by the mitochondria. Now, in chronic pain, the treatment of choice would be first to look for the cause. Get rid of what's causing the inflammation or mitochondrial dysfunction, and this can be things like medications, foods, organisms, heavy metals, or an imbalanced hormone. Use natural anti-inflammatory agents at all costs, and use natural nutrients to support mitochondria. Well, how do you measure inflammation? Not only will you have pain, but there is a marker that you can use in the laboratory called high-sensitive C-reactive protein. It's a great marker for inflammation, and in fact is used by the American Heart Association to see whether or not you're at high risk of having a heart attack. This number should be less than 0.7. If it's not, we can use tools naturally to fight off inflammation, such tools as omega-3 fatty acids. But a word of caution, many of our omega-3 fatty acids found in grocery stores and other health food stores may not have low contents of mercury, so you need to find out what the actual detection method is. Now, I like to go as high as 5,000 milligrams of total EPA-DHA per day if pain is really bad. Curcumin extract, a spice called turmeric, is seen by the Journal of Pharmacology and Pharmacy to be a natural steroid anti-inflammatory agent by blocking cyclooxygenase 2, just like Celebrex, but yet it causes no stomach problems and no elevation of liver enzymes. It's also been shown at the Oregon State University Linus Pauling Institute to be very anti-cancer in its properties. Other natural anti-inflammatory agents such as quercetin can be found in many of our foods, including black and green tea, capers, lavage, and apples. An 8-year study found the presence of 3 flavonoids, camphorol, quercetin, and myrcetin, in a normal diet was associated with 23% reduced risk of pancreatic cancer in a rare but frequently fatal disease in tobacco smokers. Now, essential to aerobic respiration is the Krebs cycle, as I stated. So treatment of that would be 1, to increase the oxygen within the body. I recommend walking each day 30 to 60 minutes. Sugar is another important part in the mitochondrial function. Make sure your fasting insulin levels are below 5. Have your doctor measure this. Any number greater than 5 at fasting indicates some degree of insulin resistance. This means sugar cannot get into the cells and stays in the bloodstream, also known as hyperglycemia. The mitochondria need sugar to begin the Krebs cycle, otherwise they go in to produce lactic acid, which also causes pain. To avoid insulin resistance, make sure you get your BMI, that's your body mass index, below 30, and your waist size below 40 for men and 35 for women. Get your hormones balanced, especially if you're age 35 or over. I also recommend for mitochondrial support the Fab 5. These would be things like Core Energy Plus, Magnesium Glycinate, Carnitine, Synergy, QAvail Nano, and Resveratrol, all of which can be found on our website at DaSilvaInstitute.com. Well, that's it for today. I hope you have a better understanding of what causes chronic pain, go after the problem, and get rid of it. And at the same time, you can use natural anti-inflammatory agents and mitochondrial support to get rid of your chronic pain. Thanks for joining me, and if you'd like to become a fan of ours on Facebook, you can follow the link below or even use your smartphone to download the QR reader and get right to our Facebook fan page. Thanks for joining me, and I'll talk to you soon.